Some patients who couldn't find relief from any painkiller, no matter how many they tried, found that a single monthly injection cut their migraine days in half. It's not a painkiller, so how does it work? Today, I'm going to explain exactly how CGRP injections stop migraines as simply as possible but without leaving out the science. To understand how the injection works, you first need to know what CGRP is. The full name is calcitonin gene-related peptide, a mouthful, but the role is simple. It's a signaling molecule released by the trigeminal nerve, the nerve responsible for sensation in your face and head. Under normal conditions, CGRP is present in very small amounts, but when a migraine attack begins, the trigeminal nerve floods the surrounding tissue with CGRP, and decades of research have confirmed that this surge of CGRP is the central trigger, the molecule that drives the throbbing pain we call a migraine. When CGRP floods the system, three things happen at the same time. First, the blood vessels surrounding the brain's protective membranes dilate. As they expand, they press against nearby nerve fibers and activate pain receptors. Second, neurogenic inflammation develops. Inflammatory molecules leak out around the blood vessel walls, making the area hypersensitive to pain. Third, pain amplification kicks in. The same stimulus that would normally feel mild now registers as intense. When all three happen together, you get the migraine we recognize, a throbbing, one-sided headache that pulses with every heartbeat. CGRP is the first domino. Knock it out, and the cascade never starts. Think about the migraine prevention drugs that existed before CGRP treatments. Most of them were originally designed for completely different conditions. We borrowed antiepileptics, antidepressants, and blood pressure medications and repurposed them for migraine prevention. Some patients responded well, but because these drugs weren't built for migraine, side effects, drowsiness, weight changes, cognitive fog, led many people to stop taking them. CGRP injections are built differently. They are the first class of drugs ever designed specifically for migraine, engineered from the beginning to target that very first domino in the cascade. So what exactly does the injection do? These medications are monoclonal antibodies, the same type of precision protein your immune system uses to neutralize viruses, but engineered to lock onto CGRP with extraordinary specificity. There are two main strategies. The first intercepts CGRP itself. The antibody binds directly to the CGRP molecule before it can reach its receptor, like a magnet that catches the messenger in transit. Ajovy, Emgality, and Vyepti work this way. The second blocks the receptor instead. It seals off the docking site, so even if CGRP arrives, it has nowhere to attach. Aimovig works this way. Either way, the pain signal cannot be transmitted and the migraine cascade never gets started. Because these antibodies are large molecules, they work primarily at the peripheral trigeminal nerve endings, which is part of why they have a cleaner side effect profile. A question I hear often: why does this have to be an injection? Why not just take a pill? The answer is straightforward. Antibodies are proteins. If you swallow them, your stomach acid and digestive enzymes break them down before they can reach the bloodstream, the same way your body digests food protein. To bypass digestion, the antibody is delivered subcutaneously, a small injection under the skin. The upside is significant. Because antibodies break down slowly in the body, they stay active for a long time. That's why most CGRP injections are dosed just once a month, and some formulations only once every 3 months. This is the most important thing to understand about CGRP injections. They are not painkillers. They will not stop a migraine that is already happening. What they do is reduce the number of migraine days you have each month. The effect is gradual. Instead of waking up the day after your first injection pain-free, you might notice that over several weeks, what used to be 10 migraine days a month becomes 7, then 5. The pattern shifts slowly, not suddenly. Responses vary significantly from person to person. Some patients see dramatic improvement, others see modest benefit. That's why it's important to stay on the treatment long enough, typically 3 to 6 months, to get a fair assessment. In terms of side effects, CGRP antibodies are generally better tolerated than older preventive medications. The most common reactions are mild, temporary redness or tenderness at the injection site, and in some cases, constipation. Serious adverse effects are uncommon, though patients with significant cardiovascular disease require more careful evaluation, since CGRP also plays a role in vascular tone. The patients who tend to benefit most are those who have migraines on many days each month, and those who have already tried standard preventive medications without adequate results, either because the drugs didn't work or because the side effects were intolerable. To summarize, the trigger of a migraine attack is CGRP, a signaling molecule released by the trigeminal nerve. CGRP injections are antibodies that block either CGRP itself or its receptor, preventing the cascade before it starts. They are a preventive treatment, not a painkiller, and they represent the first class of drugs ever designed specifically for migraine. Whether this treatment is appropriate for you is a decision that should be made with a neurologist who specializes in headache medicine. If this was helpful, please subscribe and leave a comment below.